Thank you, Mr Deputy Speaker. Over the last year, I've supported some COVID measures and voted against some as well. It's with that in mind that my constituents may be struggling with the logic of my voting record, but I believe it is indeed straightforward, and I hope to exemplify why that's the case. Where these measures have felt disproportionate to the wider harm, I voted against their introduction in the last year. An example of this was putting the constituency in differing tiers when hospital admissions were low. Where the hospitals could not cope, I did support lockdowns as proportionate in those dramatic circumstances. Where the wording of measures felt contrary to the aims they sought to deliver, I voted against their introduction. The 10 p.m. curfew was a good example of this. Everyone piled out of the pub and onto public transport, and the government eventually conceded and reversed. And that was the same concept that led me to vote against the self-isolation regulations of last week. I couldn't understand why, when Omicron was going to become the dominant variant, we were requiring people to self-isolate. It would have led to a pingdemic, and I'm glad that the government is reversing that today, and I will gladly support that regulation. As for the other three, my thoughts are as follows. For face coverings, I voted for the same outcome for retail and public transport last week. I don't want to see face coverings become a permanent feature, and I do not want to see them reintroduced in the classroom. But for a limited period of time, in the settings referenced, it feels right for me to extend the scope. For NHS workers being vaccinated, I voted for the same outcome for the social care workforce and will do so again. We know that getting vaccinated reduced the Delta transmission rate by 60%. We also know that patients who get vaccinated are not completely protected from serious illness or death. Surely, if care is in the DNA, it is not unreasonable to expect vaccination to be an entry point. If NHS workers believe that their own choices come before the safety of their patients, or if they don't believe that the NHS is about working for COVID and working for vaccines, and the evidence on those is true, I question if they are in the right profession. For vaccine certification at larger venues, I am genuinely perplexed about the outrage, and worse, at showing paperwork. Last month, I got asked for my passport when I came back into the country. I have to show evidence of purchase when I watch a football match. I was also delighted to be asked for ID, showing my age for when I wanted to buy a beer only a month back. What's the issue in temporarily asking someone to evidence vaccination or a negative lateral flow test for certain venues? If it keeps people safe and in jobs because we don't have to put more draconian restrictions on events and hospitality, then I'm happy to oblige. The impact of the Omicron variant is not known. What we do know is that the doubling rate is 2 to 3 days. For Delta, it was 7 days. In South Africa, where the variant emerged, the hospitalisation rate is now rising. Yes, the vaccination rate is lower in South Africa. However, it's also their summer, they have a higher level of antibodies from natural infection, and the average age is 13 years lower than in the UK. These restrictions are limited in time and scope. I ask myself this: what is it I will not be able to do tomorrow, which I could do last week? The answer is absolutely nothing. A little more face mask wearing, a little more admin to go to the football. If you're an NHS worker and are not going to vaccinate, then there are a record number of jobs available for you to work somewhere else. There is a larger issue at play which I find infuriating. Over 80% of my constituents have got themselves vaccinated. They are keeping themselves safe and their communities safe. They are minimising their own impact on the NHS. There are a small minority who are not playing by the same rules and have the temerity to lecture me on freedom. Let me tell them this: their freedom to remain unvaccinated and then do as they choose is reducing the freedoms of those who have done the right thing for themselves and the wider community. As a Conservative, I believe that rights are not absolute. They have to come with responsibilities. Being a cavalier for freedoms is what we were sent to this place to be. Being cavalier about the health of the public is contrary to that principle. With that in mind, I will be supporting these proportionate and limited measures this evening.